Hi, I'm Dr. Erin Fox, and I'm Director of Drug Information at University of Utah Healthcare. Today I'll be discussing a paper that will be published in an upcoming issue of the Mayo Clinic Proceedings. It's titled Drug Shortages, a Complex Healthcare Crisis. My co-authors and I discuss a wide variety of issues in this journal article. We talk about the current trends for drug shortages, we talk about reasons why these shortages are happening, as well as the clinical and economic impacts of these shortages. Also, we talk about many of the things that have been done to try to resolve this critical healthcare crisis. Today I'll be discussing two components of this paper, current trends for shortages as well as reasons for drug shortages. The University of Utah Drug Information Service has been tracking drug shortages nationally since 2001. We publish information on a public website at the American Society of Health System Pharmacists. It's ashp.org/shortage. We offer alternatives and management strategies for clinicians so that they can manage the shortage and really minimize the impact for patients. While we've been tracking shortages since 2001, this crisis really began at the end of 2009 with a large increase in the number of shortages. This trend is clearly visible in Figure 1. In this graph, each column shows the number of new drug shortages that occurred in each calendar year. Each shortage is only counted one time. For example, if a shortage began in 2008 and wasn't resolved until 2010, it would only be counted in the 2008 column. You can see that in 2007, we identified 129 new shortages that began in that calendar year. And in just 4 years, the number of shortages doubled to a peak of 267 new shortages in 2011. Now, one of the things that this graph doesn't capture are the shortages that are not resolving. So the shortages that linger on. Maybe they start in 2007 and perhaps they don't resolve until 2010, 2011, 2012. So Figure 3 really captures this data. In this graph, each column shows the number of active drug shortages at the end of each calendar quarter. So, for example, at the end of the first quarter in calendar 2010, that would be March 31st, there were 152 active drug shortages. Now, by the same time the next year, in 2011, there were 239 active drug shortages, and by the end of 2012, the number of active drug shortages has peaked at almost 300, and it's really remained flat ever since. Now, at first glance, these two graphs seem to contradict each other. Figure 1 clearly shows a peak of drug shortages, but then decreasing numbers for each year in 2012 and 2013. Figure 3 shows flat numbers and really high numbers of active drug shortages. So what's going on with this? Well, the number of new drug shortages really is decreasing, and that is in large part due to FDA's efforts at preventing drug shortages. So Figure 2 shows the number of drug shortages prevented by FDA's drug staff each year. You can see in this figure that the light gray bar shows the number of injectable drug shortages prevented each year, and the dark gray bar shows the total number of drug shortages prevented each year. Now, you can see that FDA has increasingly prevented more shortages each year, and this is in large part due to the new notification requirements that Congress and President Obama signed into law. So what this means is that manufacturers have to let the FDA know when they are going to have a supply problem. Now, what this does is it allows FDA to work to prevent the drug shortages from happening in the first place. They can work with other suppliers, they can ask for a product to be imported into the United States, and in some cases they can allow a product to remain on the market that they might normally recommend to be recalled. For example, if a vial is contaminated with particles, yet those particles can be safely filtered out, FDA may allow that product to remain on the market to prevent a critical drug shortage and patient impact. So the types of drug shortages that are occurring each year mainly are affecting generic injectable drugs. And these shortages happen for a variety of reasons, but the key reason for generic injectable drug shortages is manufacturing and quality problems. Table 2 outlines the reasons for these drug shortages in 2011 and 2012. So as you can see from this table, by far the most prevalent reason for a drug shortage is a manufacturing problem or some kind of a quality problem. Now, generic injectable drugs are a little more susceptible to drug shortages than other products. This is because there are basically only about 3 companies that make up the majority of the supply in our country. Those 3 companies supply 70% of the market. Now, if one company has a problem, that means there isn't another company that can take up the slack and make up the difference. Generic injectables also are susceptible to shortages because the manufacturers run a very lean operation. Now, this makes good business sense, but having a just-in-time inventory, having very little inventory on hand, means that a shortage can happen really quickly once it begins because there's not that extra cushion of inventory. The serious clinical impact that drug shortages have on our patients and our clinicians is really the reason why we're so worried about this problem. We know that patients and clinicians are impacted on a daily basis by drug shortages, and we hope you find this article interesting as you learn more about the reasons for why drug shortages happen, what the current trends are, as well as what is going on to really resolve this problem. Thanks for reading the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.